listeners. So it turns out Gavin and I are, and Tyler are not professional podcast hosts and producers. So we do have a little bit of a mix up that we're really excited about today.
Yeah. So we had to shuffle some things around. Wayne Couture, who was scheduled to be today's episode, requested that we reschedule. So we will have Tom Mee this episode. Tom is our CEO of North Country Healthcare.
And we're so excited for you to hear from him. He's just a really dynamic guy, I think, Gavin.
Absolutely. And I was talking with him before we started recording, and he truly has such a well-rounded background. His interests are fascinating. I think he could basically talk to anybody, which is a very unique
I think
trait.
that's true.
It's great. So
Yeah.
very much looking forward
Yeah.
to our listeners getting the chance to hear from him.
Yeah. So sorry about our delay, but without further ado, here's Tom Mee. Hi, everyone, and welcome to Rural Roots, A Road Less Traveled, a podcast by North Country Healthcare.
We're your hosts. I'm Gavin Cook.
And I'm Ren Anderson, and we're so glad you're here. Gavin, we have Tom Mee, CEO of North Country Healthcare, with us today. Tom, thank you so much for joining us this morning.
Oh, it's my pleasure to be here.
Thank you. Well, when we start out with our guests, we like to hear a little bit about the road less traveled that they took to get to North Country Healthcare. Why don't you tell us a little bit about your career and what led you to this point?
Yeah, it's a bit of an unusual story. I was born and raised in Southeast Michigan in a family of auto workers. And it was kind of just assumed that in that day and age that I'd follow my father into the plant. And did that work for a couple of summers while in high school, quickly realized that wasn't the direction I wanted my career to go in. And no one in my family had ever been involved in healthcare at all. And fortuitously, I had an opportunity as a high school senior to follow an industry leader for my last semester of high school. And I swear, for reasons that I can't remember today, I chose a hospital CEO. And the light bulb clicked for me and decided that was going to be my career path. And I'm dating myself, this was 1981. And at that point in time, this mentor, the hospital CEO, said that he thought that the most effective healthcare leaders of the future would be those who had experience taking care of patients directly. In the mid 80s, it was unusual for a hospital CEO to be a clinician, but he had the ability to see into the future, and it's a path that worked very well for me. All of my previous experience has been in very large academic, urban medical centers, multi-billion-dollar systems. My clinical background is emergency, in particular pediatric emergencies. My home hospital was an 1,100-bed facility in Detroit. And we saw about 450 patients a day in that ED, and a significant number of them were children. And in the 80s, we really didn't recognize that treating children in the acute care setting is vastly different than adults. And we started a relatively innovative program where we had providers that were double boarded in pediatrics and emergency medicine. All the nurses were trained in adult and pediatric as well. And in some ways, the most satisfying period of my career, where for 6 years I was dedicated full time to the care of children in the emergency department setting. 7 years ago, I was comfortable, and it was the CEO of a 2-hospital campus in Lansing, Michigan. Got a call from a recruiter and said, "How would you like an opportunity to start an integrated health system from scratch in rural America?" I knew nothing about New Hampshire, and but you got to recognize that in the world of hospital administration, that's an opportunity that I certainly couldn't pass up. And I tell people this is going to be my last position, and it will be my most important position. When I was active in administration of urban health centers, I don't mean to sound cold and insensitive, but if a hospital closed or a program closed, you just went to the other one that was 3 miles away. In this setting, if hospital closes or services are curtailed, people are impacted. People can die in some cases. So I've kind of come full circle, and this is intended to be the last stop of my career. And in many ways, I think this is the most important work that I've done in a nearly 40-year career now.
Mm-hmm. And you are, along with a wonderful career, you are also an outdoorsman. You're based locally, right in New Hampshire, and you get to spend a lot of time out in our rivers and trails, if I understand correctly.
Yeah, I'm pretty unashamed about my passion for the outdoors, and at this stage in my career, I'm seeking balance, and it's really that balance that I insist that all of our stakeholders have. Um, we don't exist to work, and you need that balance. So when I was looking for a career change, hunting and fishing is as important to me as my family and this career. So it's very much a three-pronged decision, and certainly the hunting and fishing opportunities are profound here in northern New Hampshire. It's a different style for me coming from the Great Lakes of Michigan, but after a hard day, to be able to be standing knee deep in a stream fly fishing in the evening, um, that's a serious relief for me,
Mm.
and a lot healthier recovery than some other paths.
Absolutely.
That's perfect. And Tom, speaking of your, after those long days, I'd love to know, and I think some of our listeners would love to know, what does a typical day look like for you? I know that's kind of a loaded question, but typical day or typical week even.
Yeah, I mean, I try to get out and obviously I work full time. So for the most part, it's a 8 to 10 hour a day job. Some reading in the evenings. I'm an avid sports fan. So live sports are my thing. So it doesn't baseball, basketball, it doesn't matter. I like all of them. It gives me the opportunity to dedicate more of my time and resources to North Country Healthcare than I might have otherwise.
Perfect. Perfect. Well, I do want to go back just a little bit. You were, speaking about your past and your leadership. I'd love to kind of dive into an initiative that started. We've talked about a few times, our One Team, One Mission initiative, and what that means to you as the CEO of North Country Healthcare.
Yeah, I mean, really, the recipe of NCH isn't that difficult, but it's relatively innovative. We're talking about, and this really came down to a fundamental question that we posed to the board while we were doing strategic planning: is what is NCH? What do we aspire to be? You know, are we a system that includes three independent yet interdependent critical access hospitals, home care, and hospice? Or are we a 66-bed regional healthcare system with multiple inpatient and outpatient sites? Well, the answer overwhelmingly was the latter. And you lead that type of system much differently than you would as if we were three individuals. And in the early years of NCH, we kind of just took the org charts and mashed them together. Now we're looking at something, and we're approaching it from a much more focused perspective with an angle towards high reliability, looking at the number of decision makers for each critical service line. One of the fundamentals of high reliability is to eliminate variation. Well, we're responsible for some of that in any of the areas where we might have multiple decision makers over the same number of issues. So we're taking a hard look at that now.
And we have the one team, one mission, where we're bringing everyone together. We're really trying to standardize our systems, but also our culture and how people feel when they come into our hospitals, from patients to employees. And we're also in the midst of now preparing for fiscal year 2026. What priorities do you see, along with the continued work on one team, one mission, that NCH workers and patients should be aware of? What are we working on as we change our years?
Well, that's a loaded question with limited time, but as I've told my colleagues, is that workforce is going to be at the top of our list of priorities for the next decade. I don't see that changing. The pandemic drove workers out of the industry, but most importantly, I think that it provided our young people with a jaded outlook of what healthcare can be like.
Mm.
So certainly we're going to be a lot more active in terms of reaching young minds and opening their eyes relative to what opportunities exist in healthcare. I'm the walking example of that. Had I not chosen a hospital CEO that day, I don't know where I am today. And I'm looking to duplicate that experience for other individuals. But certainly, workforce is going to be a significant part of what we do. And at the end of the day, the focus is really on keeping the lights on in all three affiliates. When you look at some of the changes that are coming with the Big Beautiful Bill Act and the impact on Medicaid, the focus shifts. And it's always been about life and death, but it is truly about keeping three hospitals open in northern Coas County or all of Coas County.
Mhm.
Perfect. And speaking of the big beautiful bill, there's been a lot of talk around the system of a little uncertainty, and not just our system, it's a lot of rural health systems. So can you talk about how we keep staff and leaders kind of pointed in the right direction and focused on our mission and the mission for our patients?
Yeah, I mean, at the end of the day, it comes down to mission and what the impact will be on our patients. As a taxpayer, I can appreciate the fact that we'll have fewer people on Medicaid. I mean, who doesn't sound that? On its surface, it sounds great. And those patients who previously were treated by Medicaid will go to their providers and they'll get bills and they'll pay them. Well, we know for a fact that that's not the reality. When patients lose their coverage, one, they're apt to go without care, and two, the likelihood of them paying a bill is negligible. So the thing that concerns me most about the big beautiful bill is that it assumes that fewer people on Medicaid will save us money. So from a business perspective, it's just a bad deal. There is absolutely no scenario where we remove someone's access to preventative health care and expect to save money in the long term. So what will happen is people will lose their coverage, and that's sort of insidious. We won't know that right away. We won't begin to see the impact of the big beautiful bill on our patient outcomes for months to years down the road, but it'll be like that, where somebody went without a preventative service. And unfortunately, when we start diagnosing cancers again in the ED and settings like that, that's when we'll know that the impact of the big beautiful bill was not necessarily to save money.
I want to, I know that you've been doing a lot of work with our policymakers across New Hampshire and making sure that when this is enrolled, rural healthcare systems are protected. And out of that, you've also talked about workforce. And out of that, I think North Country Healthcare, in partnership with Coas County Family Health Services, has a pretty innovative idea for the residency program. And I wondered if you wanted to speak to that and how you see the long-term effects of that program helping with provider shortages and workforce
Yeah.
and
I mean, when it comes to the residency program, it just got to the point where, look, we can sit back and we can continue to whine and complain about this, or we can do something about it. So, in partnership with Coas County Family Health Services, we formed a consortium. And last year, we got ACGME approval, American College of Graduate Medical Education. They're the organization that certifies teaching programs. And we have approval for a family medicine residency program that we hope to launch in July of 26. That would provide a pipeline of primary care physicians for our markets. At the peak of the program, we would have 12 residents in training in NCH facilities in concert with CCFHS. Studies show that graduating residents are more apt to stay in the communities in which they trained. And that's really been one of our biggest challenges. And at the end, primary care is a service line that we couldn't possibly overinvest in. If I could hire 10 PCPs tomorrow, I would. But this is certainly something it's a game changer for the North Country, and it's relatively innovative to do this in the absence of a university partner or with a big academic medical center. So we're starting this residency. Its focus will be on rural medicine because it is different. And these residents will be able to train, hopefully, in the setting in which we hope that they'll work full time.
Yeah, I'm so excited. And Gavin, I know from a recruiter perspective, you must be excited to hear about a program like that as well.
Yeah, absolutely. And I did just want to, speaking of the recruiter side of me, something I find unique about our system that you and our CNO Tiffany Haynes do very well, that I'd love to get some more insight from you, is rounding. I think it's a huge piece of our success of our employees. Can you talk a little bit about what that rounding means for you, especially coming from the clinical world and that background? Kind of what that looks like, Some people may not even know what rounding is.
Yeah.
Sure. I mean, it's arguably the most important thing I do. And for me, as a registered nurse who maintains his license, first of all, I enjoy it. I enjoy interacting in the clinical areas and talking with my colleagues in terms of what their challenges are. But it gives me an opportunity to interact directly with frontline staff and not have to go through a chain of command and get feedback that is often delayed. So when I'm rounding, it isn't necessarily how's it going and how's staffing, the things that you would normally expect to hear. I'm asking more of what can I do to better support you? What are your challenges today? What keeps you awake at night? And by having those conversations directly, I'm able to hear it firsthand. And it not only gives me a better idea of what's happening on the front lines, but I hope it creates a bond between them and myself as well.
And what would you most like NCH staff to know about the road ahead?
Oh, it's full of change. I mean, people are naturally resistant to change, but we think that we've discovered the recipe for the survivability of rural healthcare, and we think that it's this regional approach. And something that I heard a couple of years ago really resonated with me, and even more so today. We are in the last stage of system integration. It's called system optimization. And in order to optimize the system, one or more parts of it need to be sub-optimized. And people didn't really realize what that meant. And what that means is that historically, all three hospitals have tried to be all things to all people. So we have a lot of redundant programs. We offer inpatient services at all three of our affiliates. When the reality is that on any given day, we could fit all of our inpatients into a single affiliate. So there's going to be a lot of change as it relates to how we streamline care, how we eliminate the redundancies, and create a regional approach to healthcare. Because again, the focus is on keeping four affiliates afloat, and not necessarily trying to become as lean and small as we can.
That's great.
Perfect.
Gavin,
Yeah,
I think
well,
it's your
I
signature
was just gonna
question.
say I've certainly developed quite a little bit of a famous question here that we do when we wrap things up, which is, what makes you, Tom, tick every day? What makes you come to work excited for the day, excited for the week, the month? What's that thing that drives you every day?
Yeah, great question. I mean, I do have a passion for the work that we do. I do have a passion for impacting communities, especially on their clinical outcomes. But it's the mission and the team. I mean, we've developed a team of colleagues here that they're my family, and I love them the same as I do any of my other family members. And we've created a bond, and it exists because we have this common understanding of what the mission is and what we can do. And even though change is stressful and anxiety producing, but the fact that I worked, in a busy level one trauma center, I love that chaos and I love everything that came with that. So, in a world in which some of these things could cause burnout, I'm motivated by them, and I look forward to these challenges.
Wonderful. Well, Tom, we are at the end of our podcast together. Before we let you go, is there anything else that you want to tell our listeners about North Country Healthcare, about starting a career, about becoming a hospital CEO? Is there anything you want our listeners to know?
Yeah, I'd like our young listeners to know that healthcare is cool. Come check us out. There are a lot of things that we can do to open your eyes to what opportunities are available. North Country Healthcare has grown in terms of patient encounters and net revenue. We've nearly doubled in 6 years, and that's with no population growth in these communities. So it's really the community's reflection of the fact that they're gaining confidence with healthcare. And I think there used to be a paradigm where it was felt that you had to go south to get quality healthcare. You had to go south of the notch. And I think that we're opening people's eyes to what can be available in rural medicine.
Well, thank you, Tom, so much for taking some time out of your busy day to talk to
Thank you.
Gavin and I. Have a great day, and we'll see you soon.
Great. Thanks.
Thanks, Tom.
Holy moly, Gavin. I just love talking to Tom. He's just so passionate about what he does, about the care that he thinks that our patients deserve, and really making sure that our staff gets the support they need. And That's always my takeaway whenever I talk to him is, sometimes leadership is hard, but, what's the quality of life for our patients and what's the quality of life for our staff? So
Yeah,
wonderful to
absolutely. And
talk to him.
I have to say, anytime I talk to him, I love that we can have a very professional conversation and it can move to a very human conversation. And there's no pressure. I think a lot of people hear the CEO title and they, get a little
Oh,
jumpy, but
yeah.
Tom truly brings out that human side of what every role really should be, in my opinion, is we're all human at the end of the day. And, those connections are what make us all unique.
Yeah. It always bums me out a little bit when I hear people on our team say he's so intimidating because he's one of the funniest people I've ever met. He's just very, very quick-witted. And yeah, I encourage anyone when he's rounding, talk to him. Talk to him about fishing, hunting, baseball.
Right.
He wants to talk about it with you.
Yeah, I know. Even just before our call or before this episode, he and I were talking baseball, and he dove into analytics and stats. I'm like,
So
oh,
cool.
this is my
So cool.
language here. So, yeah, it's great.
Well, we have another great guest, as we always do, coming up, Jesse Raymer. Gavin, you want to introduce
Yeah,
Jesse?
yeah, absolutely. Jesse Raymer is our director of materials management for the system. He's wonderful. I've had the chance to work with him on many occasions. I think Jesse around the system is known as kind of a man of many trades. He's always running around. He's always lending a hand to anyone in need. I have not run into an issue that Jesse can't solve. I'm truly looking forward to hearing from him about not only his day to day, but his team and the work that they do in materials.
Oh, man. It's going to be great. All right. Until then, I'm Ren.
And I'm Gavin, and this is Rural Roots, a road less traveled.